Hello and welcome to our quick update on the Affordable Care Act. I'm Nicole Smith, the Benefits Education Specialist here at Flex, and today we're going to do a quick run-through of the latest developments related to the ACA. Before we get started, just a quick disclaimer. This presentation and the information contained within is being shared for informational purposes only and is current as of November 1st, 2017. It is subject to change based on subsequent federal and state laws, regulations, and guidance, and does not constitute legal, compliance, or tax advice. Now that we've got that out of the way, let's talk about the ACA. First of all, the ACA is still the law of the land. It has not been repealed or replaced, despite the best efforts of congressional Republicans. As of this recording, they have not been able to muster enough votes to pass new legislation, though they have tried on numerous occasions. So, most ACA rules will be pretty much the same in 2018 as they have been in previous years. But there are a few changes. The open enrollment period for the individual market has been shortened, and it will run from November 1st through December 15th, 2017. This does apply to both on and off exchange policies. You'll remember that the previous open enrollment period was from November 1st through January 31st, so they've actually shortened this quite a bit. The special enrollment period for the small group market has not changed, and it runs from November 15th to December 15th, although some carriers have chosen to start the SEP on November 1st. During the SEP, small groups can apply for coverage starting January 1st, 2018, with no participation requirements and no employer contribution requirements. One big change in the individual market is the elimination of cost-sharing reduction subsidies. The Trump administration has decided to discontinue these payments, as they allege that funding must be appropriated by Congress, which has not happened up until this point. An important note here is that health insurers must still provide the CSR subsidy benefit to policyholders, even though they will no longer be receiving federal funding. This change has resulted in higher premiums for silver plans, as carriers have been adjusting their 2018 rates in anticipation of these payments being discontinued. The advanced premium tax credits, sometimes referred to as premium subsidies, are still in place, and they are actually expected to be higher this year due to the elimination of the CSR funding. In fact, these tax credits might actually be enough to cover the entire premium for many people. A recent study found that zero premium plans would be available in 2018 to consumers in nearly 2,700 counties. A 60-year-old making $36,000 could find zero premium plans in close to 1,600 counties. And one making $48,000 could find plans with no premium in 654 counties. According to another study by healthcare.gov, a 40-year-old in Cheyenne, Wyoming, making $24,000 a year, could get a bronze plan for no premium. However, being a bronze plan, the out-of-pocket cost could be as high as $6,650, offsetting some of those premium savings. By comparison, a silver plan would cost that same 40-year-old about $125 a month, but the out-of-pocket cost would be much less at $2,450. Next up, let's talk about the Individual Shared Responsibility, otherwise known as the Individual Mandate. This law is still in effect for both 2017 and 2018, so most individuals will need to have health insurance or pay a penalty. The IRS recently announced that they will not accept 2017 tax returns unless health coverage status is included, an exemption is claimed, or a penalty is paid. This is a reversal from an announcement they made earlier this year, stating that tax returns would be accepted even if the insurance status was omitted. The employer mandate is also still in place for 2017 and 2018, but there have been a few updates for 2018. The affordability percentage will be 9.56%, which is down from 9.69% in 2017. The failure to offer penalty has gone up to $2,320 from $2,260 in 2017, and the penalty for unaffordability or no minimum value has gone up to $3,480 from $3,390 in 2017. In addition, ACA employer reporting is still required. The reporting is due in the first quarter of 2018, and updated forms and instructions are available. Although no new legislation has been passed, President Trump has issued an executive order which included a series of instructions for the regulatory agencies, including the Department of Labor, the Department of the Treasury, and the Department of Health and Human Services. This executive order called for a review of ERISA's association health plan rules with the goal of allowing small groups to band together to purchase coverage similar to that which is available in the large group market. He is also asking them to consider a reversal of the Obama administration's rule that limits short-term medical policies to a maximum of 90 days. The goal is to go back to a term of just under 1 year. Lastly, he has asked to ease some of the HRA restrictions applied under the Obama administration. So what's next when it comes to the ACA? Well, congressional Republicans are currently working on tax reform, and along with that comes the possible elimination of certain ACA taxes. As Congress prepares the federal budget, they'll also need to consider if they want to add in funding for the CSR subsidies. As I mentioned at the start of the presentation, legislative efforts to repeal or replace the ACA have been unsuccessful so far this year. But it is possible that we may see some piecemeal legislation being proposed that could target small parts of the ACA. There have also been some recent bipartisan efforts to fix certain parts of the ACA, led by Republican Senator Lamar Alexander and Democratic Senator Patty Murray. As of now, they haven't been able to gain much momentum, but it's possible that we may see something come out of this before the end of the year. Okay, that brings us to the end of our quick ACA update. As things change, keep an eye out for communications from Flex, bringing you the latest information about the Affordable Care Act. Be sure to visit our website at flexiblebenefit.com and subscribe to our blog and newsletter to keep you up to date. As always, if you have questions or need more information, please give us a call. You can reach out to our general agency at 888-353-9178 or to our CDA department at 866-472-5351. Thanks for watching.